Hi, everybody. Thanks for coming this morning. For those of you who don't know me, I am Sandra Clancy, and I'm the co-chair of the Family Advisory Council, which is comprised now of 17 parent members, along with hospital staff and leadership, who meet on a regular basis to collaborate around making sure that children here at this hospital receive the best care possible with the patient perspective included. So every year for the last 6 years, we have, the Family Advisory Council has organized a grand rounds that features a parent and patients, and that is the case today. The Family Advisory Council is a very active group. We do all sorts of things. Parent members have interviewed nurse director candidates. Parent members have worked with the quality and safety team on staff trainings. We have parents on 7 hospital committees. We speak with interns about the parent experience of bedside rounding. And most recently, the Family Advisory Council gave really helpful feedback. Well, we hope that the Patient Gateway folks thought it was helpful about access for children who have special healthcare needs. So we have, as I said, an incredibly active and engaged membership, and it's my complete pleasure to work with them. So the panel today, the grand rounds today, excuse me, I'm so sorry I had my back to you, is titled Showing Kids, Pediatric Radiation Oncology Peer Mentoring Program. And I am delighted to have a small part in highlighting this family-centered program. So let me get started with introductions, and our panelists are scattered. So that's okay. So Rachel Bolton is a nurse who works in radiation oncology and really initiated, along with Ario, the Peer Mentor Program. So Laura Dickman, social worker, provides psychosocial support to children, adults, and families as they undergo radiation treatment. And Caitlin Wallace, child life specialist, supports children, siblings, and parents as the children undergo radiation treatment. And I could present full bios for each of the members with all of their degrees, but let me just say that over the months that I've met with them, this team, I have been so impressed with their expertise, their knowledge, their professionalism, how thoughtfully they have put together the peer mentoring program, and how thoughtfully they care for children and parents. And if I have a tiny part in highlighting the work that they do, it's an amazing thing. So I will leave introductions to the star of the show and his parents to Rachel. So Rachel.
Thank you. So let me just introduce, this is Ario. He is now 14, and we met him when he was 7. This is his mom, Zore, and his dad, Navid. Parents have been amazing throughout the entire journey and very helpful and supportive during the mentoring program. And you will hear more from Ario later. The Proton Center at MassGeneral Hospital treated its first patient back in 2001. Since then, it has treated 10,000 patients. The number of children treated has increased exponentially since then. Presently, we treat about 15 to 20 children daily, some as young as 12 months. And in the past year, we have treated 120 children, and we see approximately 20 new consults a month. These children have tumors of the brain, spine, eye, bone, head and neck, or abdomen. Families come to MassGeneral Proton Center from around the country and the world because it has the longest standing radiation therapy program with pediatric expertise. Radiation therapy requires that children lie still on a table in a room resembling a spaceship. A specially fitted mask or other immobilization device secures the child to the table to assure they remain still. Many children require anesthesia to assure precise treatment delivery. Generally, children 6 years and younger require daily anesthesia, and depending upon the type of treatment given, some children younger than 9 will require anesthesia. The number of treatments these children receive varies from 24 to 30 treatments every day, Monday through Friday. This is daunting for parents to comprehend, and many have concerns about the long-term side effects of daily anesthesia. Could some of these children be shown how to accept the treatment without anesthesia? Factors influencing the decision and/or the ability to do so will include the child's age, the anxiety level, the location of the tumor, the length of treatment, and any comorbidities. More children may be able to have treatment without anesthesia if age-appropriate support interventions are implemented. Caitlin and Laura will explore these shortly. Our mentoring story started in 2010. Ario was a 7-year-old boy who was diagnosed with a brain tumor. As I visited with Ario and his parents while he was in the hospital, we talked about his diagnosis and the treatment that he was to receive. He shared with me what he wanted, or should I say, didn't want during his treatment. He stated, "I do not want pokes, and I don't want to go to sleep. No anesthesia." He wanted to continue attending school during his treatments. He clearly had been very attentive during our conversation. I told him that we could work together to make that happen. Enlisting the help of our radiation therapist and the mold room tech, we worked on a plan on how to mentor Ario. The plan was reviewed with Ario and his family, and they were all on board. Each step of the way, from the making of the immobilization mask to going into the treatment room and getting positioned onto the table and observing how the equipment would move while undergoing treatment, Ario was terrific. His parents were extremely supportive, and as you can see, Naveed captured these moments beautifully. Ario was able to complete his treatment without anesthesia. After the success of mentoring Ario, a discussion of the mentoring program was incorporated into the information that we provide our families at the initial consult, if applicable. Prior to the arrival for the initial consult, parents view an instructional video about the proton therapy procedure. Upon arrival to the proton center, the family will meet with the care team to discuss the treatment plan, at which time the mentoring program can be introduced. Parents and children who choose to participate in the program will be introduced by a team member to a child who is currently on treatment or has completed treatment without anesthesia. The mentor can be of any age. When possible, there is an informal meet and greet. Over the next few days, with the assistance of the mold room tech, radiation therapist, and care team member, the mentor will demonstrate how to lie still for the fabrication of the mask and treatment. The mentor and parents can answer any questions asked by the mentee and the parents. The mentor then supports the mentee during the making of his own mask and his practice. Since the inception of the mentoring program, there have been 75 children who have participated. Of those children, 7 of them were mentored by Ario. In gratitude to Ario for his dedication to helping these children, he was nominated for the 100 and was recognized as an honoree, an honor well deserved. Thank you.
Before we get to the main attraction, which we know is certainly not our care team, I'm going to talk a little bit about the collaboration with parents and caregivers. And I want to say, too, that during this presentation, we're mostly going to be using the term parents, but we want to acknowledge that not every child's primary caregiver is a parent. So we ask you just to keep in mind that as we say parents, we're really talking about primary caregivers. So first and foremost, I think it's important that everyone knows we really view the parents as essential members of our medical team. While our physicians and our nurses and our other medical team members have expertise in medical treatment and child development, it's the parents who are really the experts on their kids. And for that reason, it's very much a collective effort to decide which child might be appropriate to forego anesthesia. And there are a lot of ingredients that go into the mentoring recipe. We're taking a lot of factors into account, and we're assessing different things along the way. Our intake staff is often the first person to have contact with the parents, and they typically will ask if a child has done scans in the past and whether they did them without anesthesia. And then, as Rachel mentioned, when families come for their new patient visits in radiation oncology, they meet with many members of our medical team, and that includes child life and social work. And it's during that time that we learn from caregivers whether they feel like their child would be able to lay still without anesthesia for the duration of the treatment. But we're also learning how they're talking with their child about illness and treatment, what language specifically they're using, and also sort of how they've approached new procedures with their child. And we know that it's crucial to get parents on board with the mentoring program because kids are really taking their cues from their parents. While the mentoring program actually physically takes place in the hospital, the process of preparing a child for treatment is really something much more comprehensive, and much of it occurs within families as parents are talking with their kids about what they can expect, and also providing some reassurance and encouragement that they can manage this. So in determining when a child might benefit from the mentoring program, the recipe really includes a combination of assessment and teaching and a lot of learning from parents and families about what is really going to help a child do best in this setting. And part of that is trying to make sure we're tailoring the mentoring experience to really meet the needs of that individual child. And then in the interest of time and as a complement to what Caitlin is about to share, we wanted to talk about one quality of life consideration that might not be obvious to people who are not very familiar with proton treatment, and that relates to nutrition. So one of the challenges we hear from parents who have a child undergoing treatment for cancer is trying to get enough calories into them while they're on treatment. Treatment is disruptive in terms of your routine in many ways, but it also often is accompanied by symptoms like nausea and vomiting, which reduce a child's appetite or certainly their interest in eating. Our children who require anesthesia have to follow NPO guidelines, which really means that they're not able to eat until after their treatment and after they've recovered. So unfortunately, that means fewer hours in the day for parents to get appropriate and sufficient nutrition into their kids. And I want to be very clear to say that we're so lucky to have a wonderful clinical dietitian on our team who supports the families whose children do require anesthesia to make sure that they're getting the nutrition they need. But if a child is able to undergo the treatment without anesthesia, it simply offers more hours in the day, which can alleviate some of the pressure that parents are feeling. And in the same way that they have more hours in the day for eating, they also have more hours in the day for fun and activities. And so the family has the freedom to really organize their day in whatever way best suits the need of the family and of their child. And I'm going to leave it at that and let Caitlin take over.
So partnering with the caregivers, we offer teaching using the language families utilize at home surrounding diagnosis, scans, and treatment. Even prior to arrival in radiation oncology, some patients have seen a preparation book outlining the flow of treatment, immobilization devices, and the requirement of holding still. This step-by-step preparation book has been shared with child life specialists at outside institutions. Once the team, the parents, the patient, and the medical staff decide to engage in the mentoring process, we use preparation materials to teach and to present the information in a non-threatening way. Our radiation oncology team shows families a teddy bear with its own mask, demonstrating that the mask is made specifically for each patient. We explain that the mask is used to help remind kids to hold still during treatment, therefore using our preparation materials to outline the role of the child in successfully completing their treatment. Here's also a real sort of size mask here. This is a learning process, a process in which the staff learns about the language used at home to best support the patient and family, and in which the staff teaches the families language to utilize at home to assist with preparation and with coping. Rachel previously outlined the general flow of the mentoring process. For the most part, we are fortunate to have the benefit of time on our side. This allows us the opportunity to approach mentoring at the speed with which the child is ready. We often begin talking about the mentoring process a couple days before we would have the mentee observe the mentor. This offers the time and space for patients and families to come back with any questions or concerns that may arise. One of the most important ideals we communicate to the family is that there are no failures in the mentoring process. We can practice numerous times to increase comfortability and self-confidence. Additionally, we recommend patients and parents practice lying still at home in a more comfortable and a less scary environment. We don't actually have the parents practice, but sometimes they do. We communicate with the families that we can trial treatment without anesthesia while offering anesthesia as a backup plan. Jointly with the family, we can ultimately decide whether it is best to proceed with or without anesthesia. The mentoring process is more than just a process for kids to complete treatment without anesthesia. It is an opportunity to learn something about oneself, to challenge oneself when things become uncomfortable, and to advocate for which plan will be most successful to complete treatment. Between nursing and child life, one of the staff members accompanies the child during the first treatment. Staff is then available to provide reminders to hold still, to offer positive reinforcement, to support coping strategies, and to communicate the duration of the treatment. Staff remains available to support the child during treatments until he or she is confident and comfortable with the radiation therapist treatment team. Our radiation therapists are amazing. They provide a fun and welcoming environment, continuous positive praise, and daily step-by-step instructions. To assist with coping and compliance, patients can choose to listen to music, audiobooks, YouTube, meditation, jokes, or imagery as a distraction. Basically anything that you could listen to is on the table. So some of our pediatric patients also choose to bring a stuffed animal or other comfort item to hold during treatment. And although we've outlined the process, it is important to note that the mentoring journey is a very individualized experience that is tailored to each patient. We have patients who have been mentored by staff rather than another pediatric patient, patients who have chosen to partake in the process while not choosing to act as a mentor, and patients who have mentored numerous other pediatric patients. As Laura mentioned, the improvement in the quality of life is felt by the entire family. Not only are the caregivers able to focus on their role as parents, but the family has more time to engage in fun and normal activities. Within the hospital, patients have more time to participate in art therapy, music therapy, and hole-in-the-wall activities. In fact, art and music therapy are often encouraged prior to radiation treatment to create a calm and confident mindset. As Rachel mentioned, many of our families travel from afar to receive their proton radiation therapy. Therefore, completing treatment without anesthesia provides more time to explore Boston, to visit museums, monuments, parks, and playgrounds. An added benefit of the mentoring process is that it offers an opportunity for learning and for growing, for teaching and mastery, for social development, and for feelings of success. Conversely, traveling to a new institution and city can be a very isolating experience. Although not the goal of the mentoring program, a secondary benefit is that friendships are often created. So I know we are, and I'm sure everyone else here is ready to move on to the more interesting thing, which is hearing directly from our kids and our families. So this first family you will hear from is a letter from the mother of Kano, who is a 6-year-old child who was mentored to receive proton treatments without anesthesia. In doing so and completing treatment without anesthesia, she was therefore able to avoid the placement of a portacath.
So Kano's mom writes, "My daughter is 6 years old and she received proton radiation without sedation. The proton team here at MGH had more confidence in my daughter than I did. I think that was the key to her success in staying still for 20 minutes throughout the duration of treatment each day. The mentoring program brought a sense of relief not only to my child, but also to us as parents. Watching a child her age go through radiation without sedation definitely made us feel more confident that this is something that can be accomplished. It made us less anxious since we were able to see beforehand what to expect. If I were to give advice to other families, it would be to know your child and to understand what works for them. For my daughter, we practiced using a colander from the kitchen to simulate the mask she would put on once inside the gantry. We tried audiobooks, music, a YouTube channel for it to be an aid for her to stay still, but none of those worked. 5 seconds was the most that she could do. We discovered that she did better quiet. I tried not to distract her, but started telling her how many minutes had passed. That's when we realized a stopwatch that announces aloud the minutes that have lapsed would work for her. We used the Runkeeper app through the 31 treatments she was at the Proton Center. There was one time my daughter had a mild fever. It was then we realized how lucky we were that we didn't have to worry about her port being infected. And also, it's 2 less surgeries, no fasting the night before, and 31 less anesthesia treatments. Every day at the Proton Center was an easy 20 minutes in and out. We had the rest of the day free, so we had time to explore Boston and also keep up with her schoolwork. There is so much more that we have to deal with outside of the hospital and after the completion of Proton, such as our daughter going back to school, our family keeping up financially, dealing with the uncertainties and any grieving that my child goes through. Nothing has come easily. The mentoring program is only a segment of what we go through in our cancer journey, but the experience at MGH has worked so well with my daughter that we could check it off as one less thing to worry about. There has not been any place my daughter was able to shine since we found out about her cancer. Having a chance to mentor other kids was the first time for her to stand out since her diagnosis. Everybody at the Proton Center, the front desk staff, child life, social work, the doctors, the nurses, the radiation therapists, art and music therapists, and all the volunteers that come to the hospital have played a big role in making my child feel like a superstar. The amount of support that we had at MGH was truly amazing. My daughter has taken her mentoring and proton experience, and she was able to do an MRI without sedation back home. The experience of the mentoring program does not stop there. She also has the desire to continue to help others. And this 6-year-old said, "I'll be back to Boston for college."
And so next up, you will hear from Anselm, who's an 11-year-old, who is one of the most supportive and compassionate mentors I have ever witnessed. Additionally, you will hear from his mother about the benefits Anselm experienced during his tenure in the Proton Center. And before the video, I just have a couple pictures of him. So this is him completing treatment and walking out of the treatment room. We have a celebratory graduation bell that a lot of families will ring as well. So this is him with some of the treatment team, one of the music therapists, radiation oncologist, Rachel, and his family. And then this is his radiation oncologist, Dr. Shannon McDonald.
Hi, my name is Anselm Wan. I'm in 5th grade. I'm 11 years old. I really like sloths and music.
What was it like to mentor someone?
I felt really happy that I was mentoring somebody because it meant that I was helping somebody get through a hard moment in their life.
Did you learn anything about yourself through your treatment and through mentoring?
Well, I guess I learned that sometimes, well, a lot of the time, people have to help each other, especially in the darkest times.
Tell us about music therapy.
Well, music therapy really helped me get through radiation because every day, instead of dreading the radiation, I looked forward to music therapy at the Proton Center. And that feeling just kept me going every day.
Do you have a favorite memory from the Proton Center that you'd like to share?
My favorite memory was probably playing music with the kid that I was mentoring, Nathan, and also with the music therapists.
Outside of the Proton Center, did you have a favorite thing in Boston? Like, what was your favorite part about our time we spent in Boston? I know you love the bagels.
Oh yes, we went to Finagle Bagel every morning to get fresh bagels.
Go ahead.
I just like to say thank you to Caitlin, Rachel, Marissabel, and Hannah, and all of the other doctors like Dr. McDonald who helped me get through this tough time.
And so now here is a video of Anselm's mother.
The mentoring program really helped Anselm. It gave him authority. So instead of being the uncertain child who was being treated, he was suddenly the expert who could help other people, and it gave him power, and it sort of put him in charge of his situation, which really helped. The amazing team at the Burr Proton Center made all the difference. I couldn't have imagined that we would have such an extraordinary time in Boston. When Anselm looks back on his cancer treatment, he will remember all the wonderful people he met. He will remember music therapy. He'll remember the other children he met. The actual radiation part, I haven't heard him mention once. The machine and the mask and the whole thing, that is a blip in his memory of his time in Boston. During our time in Boston, Anselm was pretty tired, so we didn't do a whole lot, but we did go to the Science Center. We had a wonderful visit over there. We went on a duck tour. We went to get bagels. We mostly walked around the Proton Center area. We stayed at Christopher's Haven, which was an incredible resource for us. It was so incredibly helpful to have somewhere we could stay and cook and eat in. Just thank you to everybody for all the tremendous support. Caitlin and Rachel and Dr. McDonald and everyone who just was above and beyond what we ever could have imagined. I'd encourage other families to participate in the mentor program as well. It gives the children authority, it gives them the seniority, and then they aren't afraid anymore, then they're the teachers, and it makes it more fun and interesting. Anselm would have mentored anybody. He loved it. He loved working with Nathan, but he would have loved the chance to mentor other kids too. It made him feel like a grown-up, like a big kid, and it was a wonderful opportunity, and I'm thankful that you guys let him do that.
And this is just a picture of Anselm and the patient he mentored, who is Nathan, who was mentioned in the video. And towards the end of treatment, they wanted to a concert. In our waiting room, they created a band and put on a show for all of the families that were there.
Ario and his family have created a legacy in our clinic through this incredibly valuable program, and we are grateful to them both for their involvement and for being here with us today to share about their experience with the program they inspired. So now let me introduce to you Ario, Naveed, and Zore.
I just want to start this off by saying that I wouldn't have been able to do this without everyone that works here, so thank you to you all. I started radiation when I was 7, and then I had to do it again when I was 11 and 14. And so my first one was at 7. So I didn't want to do radiation with anesthesia because I had done it. I've used anesthesia before, and it just, when it goes in, it just feels weird to me. So I didn't really like it. So when I said that, so treatment without anesthesia was not overwhelming. So the radiation center has changed a lot in my 3 times of going there. But the first time, people said that it might be overwhelming, but like my parents just told me it's like a spaceship because I was into Star Wars. So I just thought it was a spaceship and you go in and then you come out. Yeah. So it wasn't overwhelming. And I wanted to make that clear in the mentoring that it was just a spaceship, basically. And for the mask, I feel like it was always weird to me, even at 14. I've done it like many times. It's a weird feeling, but it feels good, so I liked it. Sorry. So when I started mentoring, the first person I mentored, at first it was awkward because I'd never done anything like that before. But after talking to them for even just 5 minutes, you get to know them really well, and you realize that they're basically in the same situation as you. So it became like you felt good about yourself when, or I felt good about myself when, after mentoring them and it was successful. And then realizing how much it impacted and grew was just amazing. So I'm still like amazed how much it's growing. Over time, I got used to being a mentor. And so obviously it wasn't awkward after the first time. But yeah, so the mentoring really means a lot to me. So, so going back to the radiation without sleeping or anesthesia, it really helped me because I wanted to keep doing my daily activities like going to school and, playing with my friends. And doing that was, I don't know how I would do I mean, obviously I do know how I could do radiation with anesthesia, but like it would be so different for me, and like, I don't know, it's just mind-blowing to me. But I like the fact that, like they said, you come in and you go out and it's like 20 minutes. I think my record was like 10 minutes. We're trying to beat that. It has helped with my fundraising too, because I ride for the GSQ, and all of this story just helps with fundraising. So I'm really happy that I'm making an impact to help other kids, and it's still going to this day from 2010. And in the long run, I don't think we need anesthesia for radiation or MRIs. I think we can do it without that. So thank you.
So good morning. That's a tough act to follow. I do want to say thank you to the team. I remember one of the first times that Aryo had his treatment at the Proton Center. He came out and said, "Mom, guess what I found under my pillow in the gantry? A Mars chocolate bar." I did take a trip up to space and came back. So I think I'm going to just kind of talk about 3 points here: the patient-centric, the qualitative, the quantitative aspects of treatment. Today, the experience that Aryo has had is priceless. You hear and you heard from all the members of the team that there's a lot that goes into this program. But once it starts and gets kicked off, it's sort of a natural flow of the river that everything kind of falls into place and so forth. So one of the things that I want you to think about as you think about taking this model and transferring it to other departments and in different versions and sorts, it is worth all the qualitative, quantitative measures from a parent point of view. So going back to the main point, many mentioned the patient-centric aspect of this. And my mother is here today with us. One of the things that she taught me is to respect your family member as a patient, to have empathy. And that's what the team has done here. And we heard from many of the mothers and the patients that giving the control, giving the chance, giving the opportunity to the 7-year-old, the 6-year-old. And none of us would want to lose control of our health and being and what's happening to us. So the mentorship program allows the kids to be in charge, to be the expert, to know what's coming up and be less nervous as they go through treatment. And as Aryo and many others mentioned, it can branch off from proton radiation to MRIs and so forth. So the other side of this is also the quantitative part of it, from a time and effort, not only from RU for RU as a patient, but us as the parents, and also the medical team member that can, all the doctors and staffs and nurses and so forth, that can attend to more patients and be able to kind of create this home away from home. And Ari mentions that also sometimes it's like, well, I miss going to the radiation center. Why don't we go there again? So it's more than just being a medical center. It's more than a care or treatment center. It's that environment that is amazing for children. We have also branched out and gone to other centers, but there's nothing like that experience where the child comes in and they feel at home, that they have that synergy, that they don't even have, he didn't even want to hold my hand. He would just run away and go with, Rachel or one of the team members to receive his treatment. So that is a great deal, I think, in terms of the quantitative, the qualitative measures. And with that, I do want to encourage every one of you to please consider, either in a larger or a smaller scale, whatever that you can do to take away some of this and take it into your departments. It can transfer, it's a transferable skill for a child with a little bit of encouragement, as we heard. It can be transferred to the MRIs. He does his 2-hour MRIs now without sedation. And it's great because he will come in the morning, in the afternoon he's at school. So thank you all, and with that I pass it to my husband, Naveed.
Good morning, everybody, and thank you so much for being here this morning. First of all, I want to say something to you that you may have heard a lot of times, but it's good if you hear it from patients. MGH is a fantastic organization. If you work here, you may not realize it because it's work, but it's a lot more than that. When Ari was diagnosed first, we were at a different hospital. They asked us, where do you want us to send him? We cannot treat him here. And we said, because of some experience that we had on people we knew, we said we want to go to MGH. And it was the best decision we ever made. And sometimes people say, why MGH? Why not Children's Hospital? And we have come to realize that children are being treated here as kings and queens. They're beyond a patient. And care is not only what you get from your doctors and your nurses. It starts at the door with the valet. It goes all the way. And we see it in the cafeteria, everywhere that we go. So that was the first step. The second thing we realized was that we can fully trust the care team, whether it's the first doctor that we see, the surgeon, any doctor that we see. They tell us that's the best what we can do, and we just trusted them. And here we are after 8 years. In that process, I think we brew up a perfect storm with Rachel being there. Are you being willing to try something new? That's the character he has. He is always willing to take a challenge. He never says no, and he gives it his best. And we usually get a very good outcome out of it. And of course, my wife being very supportive of this. And we engaged with Rachel, and this whole program started. But it also showed us something else. Sometimes you are in a very bad situation and you think the world has crumbled down on you. But what if you look at what the outcome could be? There could be a lot of good things coming out of that. And I think that Aryu's situation was one of those cases. Just imagine, like, because of the mentoring program, we suddenly moved from the patient-parent side to the caregiver side. And we had our first chance to give back what the hospital is giving us. After that, we got involved in a lot more things. There's a Grand State Quest bike ride every year. A year and a half after Aryu was diagnosed, we started participating. I did the 50-mile bike ride. Aryu did the last 2. So we rode in together. This is the 7th year we're doing it. Last year, Aryu rode 25 miles. And with other efforts, we had like marathon runners running for us. We essentially have Team Aryu now. We also participate in the Swim Across America, which is coming up this Sunday for MGH. We're only 12 swimmers, so if you want to join us, let me know. But with that and other efforts within the hospital, Team Ario has raised over $350,000 for the Pediatric Cancer Center. This is not to brag what has been done. It shows you that there are so many ways to give back, and I would probably say it started with the mentorship, because Rachel empowered Ario, showed us that things can be done. You don't have to be an employee or a special person. You can be anyone, and you can do that. We love this place, and as Zora mentioned, Ario loves to come back here. For whatever reason it is. And the people are just amazing. Like, we don't think that we are coming to get a treatment. We think that we are going to a fun place. And that's the message that outside of the hospital we tell everybody. Like, anyone who has children who need care, or even adults, we tell them how amazing you guys are. So hear it from us and believe in yourselves, and don't give up what you're doing. Thank you so much.
I don't usually pop up during grand rounds and say things, but I feel compelled to do it today. You have really taught us so much this morning, and I, for one, am very grateful for that. Probably taught me even more than you realize. I learned just before the conference today that I actually saw Ario as a patient when he was about a year old or so. Was it 3 or 4 years old? I didn't recognize him. And so when you start talking about how you taught other children how to deal with this, and you feel very good about that, I can't go near an MRI machine without some Ativan, and the more Ativan, the better, actually. And Ativan is a sedative, as you know. And so after this is over, I'm going to take your phone number, and you and I are going to have some sessions so that in the future, if I need another one of those, go near another one of those machines, I'll be able to do it with some music and a Mars bar. That's what I'm looking forward to.
Ario will be there.
I'm counting on it. And so to Rachel, Laura, Caitlin, Sandy, and you and your family, thanks so much for teaching us so much this morning. This is what pediatrics is all about. We're often asked, what pushed you to go into pediatrics? I think if you just listened to Grand Rounds this morning, you'd know what pushed all of us here who are in pediatrics to do it. And it is this sense of being part of a family, not only that we take care of families, they're central to who we are and what we do, but that we're part of a family, and we work as part of a family, and that's one of the largest lessons that we heard this morning. So thank you so much to all of you. Ario, you're a star, and I'll leave it now to other questions.
Also just going to move through some more photos that we got caught up in talking and didn't show you. We have Ario now.
Some current. Not as good as in person, but some more pictures too. So this is Ario making his mask this last time. And this also shows you how the Proton Center has changed since 2010. So now there's now lighting, there's a floor in there. Proton Center has also grown. Okay, that's it. Thank you.
Ario, I'm wondering, when you mentor other children, what are the sorts of questions that they ask you? What's on their minds?
I think
the most common question is it scary? Obviously, no, it's not. I've also just common questions from the person I mentor and people who just ask me from outside are that, does it hurt? No. A lot of the question I can remember the most, because it's just so crazy to me, and I get it a lot, and I don't know why, is does the needle go through your head? And it's just, no, I just lay there for like 20 minutes, that's it. But, so, yeah.
So this is a question for the staff people who set this up. There's always considerations regarding HIPAA and how you set up these mentoring programs, and we get caught up sometimes in the red tape of that. Are there any considerations, privacy issues? Did you have the mentors go through the volunteer program at all? I know as we've tried to set up a mentoring program in our IBD program, we've had a lot of those considerations.
So thank you so much for asking that. And this is sort of a newer question that's come up for us and a dialogue we'd love to have, because sort of the more classic idea of what a mentoring program looks like involves a lot more information sharing than this particular program. We have not had to jump through as many hoops. That said, we are interested in thinking about, are there better ways to prepare families? So in this program, we're really not giving any information away. So we don't have to share what diagnosis is. We don't have to share ages. We don't have to share really much protected health information. So we get the consent from both families to participate, and we introduce them. And then the extent of it is really laying on the table, showing what it looks like, showing what it is to stay still, so it seems more manageable to the child who's being mentored. And anything that happens from there, any information that's shared, isn't really facilitated by us. That happens outside of the hospital of the volition of the families. I know Caitlin mentioned that that's been a secondary gain. That wasn't our initial intention, but many families do decide to continue the relationship.
I can just elaborate. As we worked with the parents, with the mothers, we met with the mothers or the fathers. They weren't really interested in what was exactly Ario's detailed diagnosis or treatment. They only asked, okay, did he go through radiation? For how many sessions? For how long? And did he do it with sedation or not? And that was the general conversation. So that was the initial question that they came up with, and then as the friendship, and we love socializing. So as we became more friends with them, then there was more natural flow of exchange of information about the treatment. But in the initial meetings, all they needed to know was that yes, he did go through a proton radiation treatment for 5, 6, 7, 8 weeks, and did he do it with sedation or not?
Great job, Ario. Have you done any presentations to your classmates at all? And have you published any of your work?
In 2010, my first radiation, I did talk about it with, I'm pretty sure it was my grade, not my school. That was too big. But after that, in middle school, it kind of became known that I was doing this because I had a surgery in middle school. So in high school, I haven't really talked about it much. I did end up having a surgery in high school too, so everyone kind of found out, but I haven't really talked about it, so no, not yet in high school. Maybe.
All right, we'll wrap up. Thank you so much to everyone who organized this and to Sandy.